Yep.
Hi, my name's Dr. Allen. I'm one of the GPs at Burley Health Centre. So we just want to have a chance to kind of meet some of the team and learn about some of the new roles, see what people do. And so we're going to meet Michaela today, who's our pharmacy technician, and she's going to tell you a bit about what she does. So I'm going to turn my camera around. Hello.
Hi.
So if you could start just by telling us a bit about what your role is, what you do, and how you help patients.
So I'm a pharmacy technician employed by Township Once basically. I work at Burley and Althorpe. I've been here since November. Part of my role is making sure that when you're discharged from hospital that your discharge summaries are updated quickly so that your medications are correct for you at that point of discharge. This relieves a lot of pressure from GPs because realistically they're not actually needed to do that. We can step in and do it. Part of that role also involves making sure that any blood tests you needed once you start on any new medications are booked so that you're getting them in time and when you need them to make sure that medication is safe for you to carry on taking.
Yeah. And I think you're probably more systematic than we are because we're often, as GPs, doing lots of different things, whereas you can sit down, concentrate and work through it and
So we will put I'll try and put some time to one side every day to make sure any discharge letters that have come to me are processed quickly. So ideally within 2 to 3 days of me receiving them, I like them done and gone. I don't like a backlog.
And what other kind of things do you also do?
So we're currently looking at getting me up and running doing med reviews. I do some of those at Althorpe. Ideally patients should have a med review every 12 months. This may be just done online, checking that all your bloods are up to date and in place. It may involve a quick phone call to a patient if that's suitable, or very occasionally they may be seen face to face.
And are there any other occasions where people might come across you, their patients? And what other things might you help people with?
Any medications which are struggling to get hold of, they'll come to me for alternatives. This can come through from patients or from pharmacies. If it comes through from a pharmacy, ideally if they can give us an alternative as to what they've got on the shelves, it makes it much easier because we don't keep a stash of medication here, so we don't know what alternatives are out there always.
And I know that you help reception, don't you, when there's difficulties or just around the prescription process?
They'll quite often come to me because they are electronic, sometimes things go wrong. They might get sent by accident to the wrong pharmacy because it is electronic, so it might get sent to the wrong pharmacy. And it's not just a simple case of always just printing another one. It can be quite complex sometimes.
Sure. And so what do you enjoy most about your job?
I think because it's a developing role, I'm interested in looking how it's going to develop in the future. So, but I'm just enjoying at minute the new role and also getting my teeth into it, and also knowing that these queries aren't lingering there. If we can deal with them straight away, we will do, and it relieves pressure not just for GPs but also for the people on reception and the admin team. So it is sort of a background role in some ways, but I do think it is proving valuable because it is relieving pressure from other people you might see more face to face.
Definitely. And what's your background? So where did you come before this role?
So I spent 20 years working as a hospital pharmacy technician at the Hallamshire Hospital on a specialist unit there, which was fascinating. I spent about 14 years working with quite a rare condition called pulmonary hypertension, and also obviously in the dispensary at the hospital, and prior to that I worked in community. So I've had about 25-30 years of pharmacy experience now.
Great. And it's so valuable because it really does, I think it helps keep the medication system safe. You help GPs, so that means we can see more patients. It's really valuable, and you do a really great job.
Thank you.
So it's great to have you as part of the team.
Thank you.
And you may come across Michaela in the next few weeks and months. All right. Thank you.
Thank you.